Today we are going to be discussing ovarian cysts, types of ovarian cysts, symptoms, causes, diagnosis, risk factors, and treatment of ovarian cysts. A lot of people have asked me about ovarian cysts in my comment sections from my previous posts, and I've decided to make a video about it. I'm going to elaborate on it in this particular video, and by the time we are done, I believe all your questions regarding ovarian cysts must have been answered. So hello guys, what's up and welcome back once again to my channel. This is Everything Health with Nurse Dara. If you're seeing this face for the first time, I'm Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. If you're interested in this topic, keep watching. Ovarian cyst is a fluid-filled sac that is found on the ovary. They are very common and usually do not have symptoms. That is, women who have ovarian cyst usually do not experience any symptoms. Most of these cysts occur naturally and resolve on its own after few months without any medical or surgical treatment. We have two main types of ovarian cysts, and that is functional ovarian cysts and pathological ovarian cysts. So the functional ovarian cysts are the most common types of cysts. They occur as part of menstrual cycle. They are short-lived and they resolve quickly on their own after few months without you even knowing you had cysts. They are harmless and they resolve on their own. While pathological ovarian cysts are less common, they occur as a result of abnormal cell growth. So how do you diagnose ovarian cysts? If your doctor suspects that you have ovarian cysts, you'll be referred for an ultrasound scan, where a probe which carries camera will be placed inside your vagina to look for the cysts. Now let's talk about causes of ovarian cysts, where we have ovulation. Yes, ovulation is one of the causes of ovarian cysts. This occurs when the follicles grow. You know, before ovulation, the follicles are growing. One of them will grow larger than the other ones, and we're expecting that one is going to break open to release an egg. But then this one grows and it fails to break open to release an egg, and then it forms a cyst. Then another one is endometriosis. People with this condition can develop what we call endometrioma cyst. Another cause is PID, pelvic inflammatory disease. If you have pelvic infection, you can develop a pus-filled cyst on or close the ovary. Then abnormal cell growth. This occurs when the cells in your ovaries develops in an abnormal way, and this can lead to dermoid or cystadenoma cysts. Other causes of ovarian cysts includes pregnancy, PCOS, that's polycystic ovarian syndrome, non-cancerous growth, and cancer. Let's talk about the risk factors, like what can predispose you to having this ovarian cyst. One, we have age. If you've come of age that you get your monthly menstrual cycle, you are at risk of having ovarian cysts. This is less common in people who are too young to have periods and people who have reached menopause. Another risk factor is hormonal problems. It is more common in people who have conditions that affect their hormones, like PCOS, polycystic ovarian syndrome. They are at risk of having ovarian cysts. Another risk factor is taking fertility drugs. Using drugs like clomiphene citrate, that is Clomid, to help you ovulate can increase your risk of having ovarian cysts. Another risk factor is pregnancy. A cyst that forms during ovulation can stay on your ovary after you get pregnant and throughout your pregnancy. Another risk factor is previous ovarian cyst. An ovarian cyst can occur again if you've had it before. So what are the symptoms of ovarian cyst? How do you know you have ovarian cyst? Ovarian cysts are usually asymptomatic. People who have ovarian cysts do not get any symptoms at all, but symptoms occur when the cysts are too large or they twist and block blood supply to the ovaries or it ruptures. Some symptoms include pelvic pain. This pain can be dull pain or a sudden severe sharp pain. Pain during sexual intercourse, difficulty emptying your bowels, that is difficulty defecating, frequent micturition, that is frequent need to urinate, heavy periods, irregular periods or lighter periods than normal, feeling full after eating a little, bloating and swollen tummy, and in some cases difficulty getting pregnant, although ovarian cysts do not usually affect fertility. Also, seek immediate medical attention and treat as emergency if you experience any of these. 1. Sudden severe pelvic pain. You have pain in your tummy, that is in your abdomen. You feel sick, you feel nauseous, or you're vomiting. You have fever, you experience fast breathing, you feel dizziness, weakness, or feeling faint. Seek immediate medical attention if you experience any of these. So let's talk about treatment of ovarian cysts. Okay, ovarian cysts resolve on their own most of the time without any intervention. These 3 methods can be used when it comes to treatment of ovarian cysts. 1, we have palliative care, or what we call watchful waiting. So in watchful waiting, the doctor can decide to monitor the condition for some time and see if it will resolve on its own instead of taking action right away. Then the second treatment is use of medications. If you're experiencing pain from the ovarian cyst, your doctor can prescribe pain relief drugs that will help ease the pain. They may also prescribe birth control pills or other hormonal treatments to stop the cyst from growing and prevent new cysts. Another treatment method is surgery. Your doctor might consider surgery if the cysts are too large, they keep reoccurring, they don't go away, they just keep reoccurring, or they cause serious symptoms. So your doctor will discuss with you to know if you need surgery or not, and your doctor might decide to take away just the cyst or the entire ovary depending on the situation at hand and the discussion he had with you. So here is my little takeaway from this ovarian cyst. It is a common condition that occurs in women. If you're a woman with menstrual cycle, you're likely to get ovarian cysts. The cysts are most likely to resolve on their own without any treatment. But go to the hospital when you experience severe symptoms or it becomes an emergency. Also, if you're trying to conceive or you have plans of conceiving in the future, I will advise you to allow the cyst to resolve on its own or use the medication method of treatment instead of surgery. Okay, surgery can cause scarring on the ovaries, which can further cause a decline in fertility for the woman. So at the end of the day, if you're finding it difficult to conceive or you're experiencing severe symptoms, speak to your doctor. He will carry out some investigations and decide on the best method of treatment that will benefit you based on your individual situation. So with this, we've come to the end of today's video. If you enjoyed watching, don't forget to give this video a huge thumbs up, subscribe, leave a comment in the comment section if you have any question, and I'll be there to respond. Turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned and see you in my next one. Bye.